So, dear colleagues, in the next 10 minutes, I thought I'd do two things. First of all, I'm just going to try and explain the problem we are solving. But then do something you should never do on stage. We're going to do a live demo of what we actually do here in the room by showing the product. And if we take the first product, problem I'm trying to solve, on average, a doctor spends 2.3 hours every day writing clinical notes. And this is true also for psychologists, physiotherapists, and many other groups. It varies by specialty, by country, different traditions in note-taking, but it's a lot of time we spend on writing medical notes. Next. Of course, it's been an evolution. We have many countries where doctors write themselves. There was an evolution where doctors dictate into solutions like med-speech, and we have secretaries writing this up for them separately. For 10, 15 years or so, we had these solutions which is direct text-to-speech. I speak, and we have a verbatim translation of the text into the journal. But really what's happening now is that we go on a basic idea and paradigm that most of the information we do in the clinical room has already been transferred between me as a doctor and the patient. I've already said the things that we need for the note. So having me go on the side and try to remember this and do a poorer version of actual events, it's not just logical to do anymore. So we work with 150 organizations around Europe at the moment, and so we start to have pretty good data on what the savings are. Somewhere between 1.3 and 1.8 hours per day is saved for our customers. I would be honest and say, not everyone brings into new patients and see more. Some do, and quite a lot. Some just actually creates more space in the schedule, and some do other things that we want our colleagues to do for attention in other parts. So a lot of time saved, and then there's up to the organizations what they do with that time, basically. So that is one of the values, but also things like patient safety. We now have more accurate and complete medical notes and notes on time. We have a customer, they have an average delay of 8 days between the actual interaction and when the notes are ready for other colleagues in the hospital. Now it's instantaneous. Accurate coding. We have a perfect transcript of what's happening. So all those comorbidities, all these other things, we can easily get into the system straight away and on a very high accuracy. So even payers and insurance companies can safely say, okay, can we prove that your coding is right? And we can easily provide that transcript. Work environment, less stressed doctor, happy doctors, nurses and other colleagues. And of course, patient interactions. This is the most pleasing part of this. Patients saying that finally I had a clinician, we did a survey, where they felt they are much more present in the now, much more repeating and playing back what's happening in the room. So lots of values from something relatively simple. But let us show you how it works.
Good. So now we're going to show the product. Yep. Can you see it here? So a very simple interface. By the way, I'm Jorge Perez, Dr. Jorge Perez. I'm part of the medical operations team leading here the expansion in Spain. And so we're going to reenact a conversation between Oscar, the patient, and me, the doctor. So with further ado, let's kick it off. Oscar, then let me know, why are you here today? What happens?
I have experienced shortness of breath lately when I take longer walks, and so, yeah.
Okay. And can you tell me a little bit if you have any diseases, if you're taking any medication?
No, not really. I feel pretty healthy. Some time back, they talked that I had high blood pressure, but I didn't really think it mattered, so no.
So you didn't take any medication for this, right?
No.
Okay, interesting. Do you smoke?
Oh, no, not anymore.
Any allergies?
No.
Okay, that's good. The nursery team just sent me your oxygen saturation, which seems to be good at 98%. However, that blood pressure seems a bit high as well. They've sent me 160 and 95. So I'm actually going to check out and auscultate and explore your heart and your lungs. Let's do now as if I was auscultating it. Your heart actually sounds good. However, in the lungs, I'm sensing some crackles in both bases. So I'm afraid that we could be potentially talking about heart failure causing this shortness of breath, and probably related as well to this high blood pressure that you haven't treated. So I think we are going to start with taking 2 pills for the hypertension, one being enalapril and the other one being hydrochlorothiazide. We're also going to do an electrocardiogram and an echocardiogram just to check your heart function a bit better. And we're also going to do a full blood count, checking also for some heart failure biomarkers.
Can I still drink wine in Barcelona?
Yes,
Okay.
yes.
Great.
Perfect. And then I think let's also try that you go to the Montjuic light show.
Yeah,
I know you
perfect.
like that
I love
one.
it.
Good. So now we stop it here, but we could resume the recording in case we wanted to add some elements we necessarily didn't want to verbalize in front of the patient. But since this is not the case, we're going to create the note. Again, output is going to be in the SOAP note, but we could also choose different ones. And let's see the magic happening here. We're having a little bit of internet connection delays, well, typical things of the live demos. But
one important feature that, of course, been built in is the language sensitivity. Many of the models trained today are very good in English, but not that good when you go across different languages. So, for example, we've seen when you have an interaction in one language and want the note in a different one. So we have customers in the Middle East, for example, where interactions are in Arabic, but the notes are written in English. Or if you have immigrant communities in Sweden where both doctor and patient speak Persian, for example, and then the note should be written in one of the Swedish languages. That's been one of the key features also to enable more colleagues to integrate in society when they're working in the medical professions.
Yes. Sí, antes funcionaba. And here it comes. It took it a little bit of time, but here we have it. So we can see how it has captured only the clinically relevant topics, so no mentions to the beautiful Montjuic lights. And as we can see here as well, the heart looks fine, but it typically gives it in medical lexicon. So whatever a medical doctor would write, should the heart exploration be right, keeping the systolic and diastolic blood pressure on spot on. So it is for the saturation. And again, the assessment of a potential heart failure, shortness of breath, likely related to the untreated hypertension, picked up as well the plan. And then you can also seamlessly add, with one click, the ICD-10 diagnostics codes for the disease that were discussed here. And maybe we can do also some smart adjustment here, so we can tell them to say, well, let's add that the father of the patient died at 65 years old due to cardiac arrest. And we could seamlessly integrate that into our notes.
And can be said that today we do some 100,000 notes a month across the 150 organizations, and roughly half of the notes generated go into the EHR without a single edit. That's the quality of the notes we're getting at, and we think on the very competitive market, that's where the bet is going to be, to have the most accurate note by specialty across the different parts.
Perfect. Thank you so much
Thank you
for your time.